A very warm welcome, everyone. I, Dr. Ritika Dhaman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well-being day and night. Voice of Healthcare, along with our supporting partner, Apollo Hospitals, has taken an initiative to recognize National Doctors' Day through our video series, Know Your Doctor, which aims to showcase the diverse interests and passions of our esteemed doctors. On this National Doctors' Day, let us express our gratitude to these extraordinary individuals. So let's get started with the introduction. I welcome Dr. Sameer Dani, Senior Consultant Interventional Cardiology, Apollo Hospitals. Welcome, Dr. Sameer.
Thank you so much for having me here.
Wishing a very happy Doctors' Day.
Oh, thank you so much. And I guess wish you the same Doctors' Day. Very happy Doctors' Day to you also.
Thank you so much, sir. So, moving on to the discussion, have you ever used your medical knowledge or skills in a unique, unexpected situation outside of a traditional hospital?
Well, yes, number of times. In fact, 2 or 3 instances that come to my mind. One of them I would recount, and that happened when I was just a medical intern. And I was going to Kashmir with a few of my friends. I was going to join them at Pathankot. I was traveling by train. We were going to Kashmir for trekking. And in my compartment, there was an old guy who happened to have an asthmatic attack. And they called out anybody who is a doctor there. And I very proudly went there, but didn't know what to do. Being just an intern, I did not have enough clinical experience. But when I looked at him, he was gasping, really very bad asthmatic attack. And the only thing I could find in the railway compartment was an emergency kit which had adrenaline, epinephrine injection. And I filled the vial up, broke the vial, filled the syringe up, and gave him subcutaneous adrenaline because I had read in our pharmac textbooks and I had heard that epinephrine can be given subcutaneously. For asthmatic attack. It used to be. It is an outdated treatment. It was an outdated treatment even then at that time. But I did it and he recovered miraculously. And when the next station came, he was wheeled out and the emergency medical team came. And I felt very, kind of proud to be a doctor. Sometimes I look back and I think that would I do that now? I would really be very scared to do that, thinking and using an outdated treatment, which is risky, of course, to give it to such a patient. And I would rather wait for an emergency medical team to arrive? But there is no definite answer to that. But looking back, I think it was a very proud moment after just becoming a doctor, getting the MBBS degree, to do that. And I still remember that old man's face very clearly. Another thing that does come to my mind is not using my medical skill, but using or flaunting my being a doctor and getting some unexpected response. I was in a place, in a city called Rouen in France, and I was... the first month of my being there, and I had very limited fellowship money at that time. And I got a stupendous bill of electricity and gas. And when I looked up at my meter, the numbers were not matching. And I thought that there was a big mistake. And I went to the electricity and gas company of France office. Had a huge queue. I patiently waited, went to the end of the queue, told the clerk in very broken French that I had a problem. And I am a doctor. I'm working here in this hospital. And the bill is not matching with my meter numbers. And I was expecting that he would tell me, what can I do? It's a printed bill. You have to pay first. and then you have to complain, etc., etc. But he just looked at me and said, "Oh, you are a doctor. Oh, you are from India, Indian doctor. Well, we like Indian doctors." And then he told me, "Okay, what is the number on your meter? And I'll make a fresh bill for you." It was astonishing moment for me that he was willing to place so much faith in me just by my saying that I am a doctor and I'm working in a hospital. He just changed my bill, and I paid that bill and went away. I kept on thinking that someday some government official will come and knock on my door and would ask to see my meter, but never happened. So
That's a very interesting story. And what you've told the story, the earlier story that you've told, doctors wherever, anywhere they go, they save life. So you saved their life that day when you injected the adrenaline to an asthmatic patient, but you saved him. So I'll take that wherever the doctors go, they save a life. So I'll yes. And the second situation that you told about is interesting, that they have such faith in doctors, no matter which country you are from and no matter what country you are going. So that is something very interesting to know. And how you are an interventional cardiologist, so how do you foresee the future of interventional cardiology in the upcoming years?
yeah, I'm in a very interesting field. Actually, interventional cardiology developed into a separate field about 25, 30 years back. 30 years back, and then it has been growing very rapidly, and lot of advancements have been made, and thanks to mainly our engineer friends and the technology. The medical technology has advanced so well and so fast that there are some amazing things which, when I entered this field, I thought would never be possible. I am actually doing them. So, I think that interventional cardiology is going to grow further with the help of technology, especially the nanotechnology. We are going to be able to repair. I'm using the word repair because it actually is when you use technology and science together. You can mend the broken heart in ways which previously were not thought possible. So more and more diseases are amenable to interventional cardiological procedures without doing surgery, without opening the chest. We can do we can repair lots of structural heart defects. We can do a lot of functional repairs. We can open up blocked arteries and so forth, so on and so forth. It is going to grow, and with more and more implants and wearable technology, we will be able to look into people's heart, diagnose their condition, and treat them without actually opening the chest. So I think future of interventional cardiology is going to be extremely bright, and the technology is going to take it to heights which we have never expected.
Yes, we hope that too, that the amalgamation of technology and medicine will create a lot of paths in the future. Ending this interview here, what is the message that you would like to give to your fellow doctors apart from the professional settings, apart from the professional front?
Well, apart from the professional front, I am reminded of one very famous line from a movie, uh, uh, and that line was that if you treat disease, you win sometimes, you lose sometimes. But if you treat the patient, you will always win. So, as far as profession is concerned, I think your attitude and the sense of compassion is as important as your competence. And while talking about that professional thing, one must not forget that the doctors have to take care of their health too. So we should practice what we preach.
That's a very great message that they should take care of their health as well. And the line that you have just mentioned, that treat the patient, not the symptoms, is it's the one line that I heard when I saw a series called House MD. So in that series, it had the same line, that treat the patient, not the symptoms. You have to go to the roots of the disease to treat. And yeah, and you also have to take care of your health to treat your patients as well. So with this, I would like to end this interview here. I would like to thank you and all the doctors who selflessly serve our nation's health. Together, we salute your dedication, compassion, and unwavering commitment to our health. So thank you so much, Dr. Sameer. Thank you.
Thank you. Thank you, and wish you all very happy Doctor's Day.
Same to you, sir.